Welcome to week 4. Hope you're enjoying this course so far and enjoyed learning about the integumentary system. We're going to dive a little deeper through the skin today to look at the skeletal system and week 4. So I've taken the skeletal system, I've actually divided up into 3 different weeks. So I used to have one long module, but I decided to make 3 different modules. So you'll actually end up seeing, I'll have them all published this week. But you'll have weeks 4, 5, and 6 that are all skeletal system. Week 4 will kind of lay the foundation. Week 5 dives deeper into some lab work and joints and bone identification. And then week 6 helps put everything together. And so you'll want to make sure you stay focused on those. So your end of module assessment won't be till 6 right here. Now week 4, okay, you got your skeletal system outline here. Make sure you use that outline to take notes as you read and watch videos. It's a great way to structure your reading and your understanding. There's also a bone tissue physiology PowerPoint if you prefer to have PowerPoints. That's a good way to take notes as well and structure your readings and your notes during watching videos. You have your 4 different activities and readings and videos to watch here to help you learn that content. And then your first activity is on bone cells. So you're going to look at the different types of bone cells, how they developed, because there's actually, so you have osteoblasts that build bones and you have osteoclasts that break down and shape bones. Both of them come from different types of cells. Both of them are activated differently, and both of them play a role in our bone strength and density, but have different roles. So you want to make sure you pay attention to that. And then you got the self-evaluation quiz. You got the team patient case study number 2. I'm actually going to be adding new information each week. So over the next 3 weeks, you'll have new information on Mondays of each week that cover this patient case study. So next week you'll get more info, and then on the 3rd week you'll get more info as well. So you'll want to make sure you stay on top of that. I have another reading for you here to do, and then you have a bone development activity. So bone development is talking about how the two different ways our bone develops in our bodies, long bones versus kind of flat and irregular bones. They both become your calcium and collagen matrix bone with compact on the outside and spongy on the inside, but they do it in different ways. Okay, so you have intramembranous ossification and you have endochondral ossification. One kind of forms like a sandwich, the other one kind of forms from within and uses cartilage as a skeleton to build on. Like we all kind of start, our long bones all kind of start as cartilage, hyaline cartilage, and then we build from there. So you'll learn more about that as you do the bone development activity. And then once you're done with that, you'll do the self-evaluation quiz on bone development, and you'll move into week 5 and week 6. So I'll have more intro videos for week 5 and week 6. Make sure you do these in order. Stay focused. Start with that outline, print it out, take notes on a piece of paper, and make sure you use that as a guide as you're reading and watching the videos. And as always, get in touch with me, schedule a Zoom meeting if you need to, shoot me a message on that phone number, or send me an email or chat in Canvas. I want to make sure you guys are doing well. In terms of the previous module, you guys have turned in your end of modules today assessment, so I'll be starting to grade those this week. It will probably take 3 or 4 days to get those graded, but I will post feedback in the announcements in terms of the overall answer before that, so that you have quick feedback, and then I'll grade it individually and give you your score, but you'll have an idea of what the overall answer is for each of those case studies for Donna and Anthony and Rachel. So anyways, thank you. Hope you have a wonderful day, and let me know if you